Welcome to the MHS Cast. This is the live stream. I will be your host, Guy Danhoff, and tonight for our second episode here, hosted by Missouri Healthy Schools, we're going to be talking tonight on diabetes management. And there's a lot going on, certainly in that area, what's going on with schools. And so we've got a great broadcast for you tonight. For those of you who may not know me, obviously I am the host of the MHS Cast. I'm also Missouri Healthy Schools Outreach and Digital Media Manager. I also serve as the creative director for, maybe you've seen some of our work called On the Move Mo, School Success Stories, Advocacy Videos. Those can be found on the Missouri Healthy Schools YouTube channel. So without further ado, I want to bring in our guest. And our guest is Dr. Katherine Park. I'm going to bring her on right now. And Katherine, first and foremost, how are you doing?
I am doing well. Thank you so much for having me on again. It's a pleasure to be here with you this evening talking about diabetes. Definitely, there's a lot to talk about, so I'm very excited to be here.
Well, I know that we're really excited because, as you brought up to us in our meetings, that this is now National Diabetes Month, and we've really got a lot of cool things to unpack of what's been going on in schools. And, you know, Katherine, I'd like to start the show a little different because maybe some people aren't as familiar with your work, but could you maybe give us a little background about yourself?
Sure. I have been in school nursing for 19 years, and I have learned so much during those years. I had the good fortune to go back to school in 2009. I received my master's degree. And my emphasis back during that time was on type 1 diabetes in the school setting because I had been working with a number of students over the years, and I just found it extremely challenging and really a chronic health condition that piqued my interest. I also went back to school in 2018 and received more recently my doctorate degree. And again, I had type 1 diabetes as my focus. So it's really something that I have focused a good part of my nursing career on.
So, Katherine, one of the starting points that I like to do on our live podcast is, could you maybe, give our audience kind of the state of the union on what's going on right now in diabetes management, particularly in Missouri schools?
There have been so many changes. It's really, really overwhelming when even I think about it, and I'm immersed in it on a day-to-day basis. I do work in a school setting currently as a school nurse in St. Louis. And again, over the years, I have been in school health and school nursing for quite a few years. Over the years, diabetes has changed dramatically. When I first started, it really doesn't look the same at all currently as far as practices and how we as nurses and school staff manage diabetes in the school setting. There have been trends that I'm sure you may be aware of in increases with diabetes. We hear a lot about type 2 diabetes, but type 1 diabetes has been increasing as well. And the most recent statistics that I found about type 1 diabetes increases came out of the CDC about a year ago. And they've been doing some long-term studies on type 1 diabetes. And over the past approximately 2 decades, so we're going back about 20 years, we have seen an increase of 45% in cases of type 1 diabetes. So I know that sounds a little bit alarming, and it is. Of course, that's spread out over 2 decades, but definitely there has been an increase in cases. As far as nationwide, we have about just under 200,000 children under the age of 20 with type 1 diabetes. In the state of Missouri, our most recent data that has been collected from schools that report chronic health conditions, we were just over 2,000 students with type 1 diabetes. So I think it's 2197 in our state in Missouri, students under the age of 20 with type 1 diabetes. So it is something, while these numbers may seem small compared to other chronic health conditions, it is something that I've always been really focused on, and something that is definitely increasing.
And Catherine, kind of paint this picture for our audience, because I think one of the things that I took down in my notes when we had a chance to talk these past few weeks, talk to us a little about what's made the numbers so challenging because of COVID, because of the irregularity in getting the testing, especially for those maybe in middle school and high school.
Well, certainly, I think all of us can talk about the challenges COVID has posed to us, and diabetes in the school setting would be the same. That definitely did have an impact when we were on remote learning. There was definitely an impact. The last couple years, as far as students receiving good care, that has been delayed. We're seeing students that are struggling right now. Overall, with care and management in the school setting, there have been a lot of changes, like you just indicated. COVID, I think, set us back a little bit, though,
Yeah.
as far as where we were before COVID, and now we're trying to pick up the pieces and continue on.
Yeah, and Catherine, one of the things that I was so impressed with your body of work is how you implemented through your research. And I'm going to bring that up on the screen for our audience. Talk to us about how you developed a staff diabetes training toolkit back in 2009, but why it's still so relevant even here in 2022.
When I was working on my master's degree, I made type 1 diabetes the focus of my work. And at that time, there was a need in the school district that I was working in. And we had an incident a couple years prior where a school nurse had an emergency of her own. Actually, an ambulance had to be called for the nurse. And she turned out to be okay. But in the chaos you can imagine that created, where a nurse was being taken out of the building, we had 3 young students with diabetes. This was an elementary school building, and we had 3 young students in that building, and nobody in the building except the nurse knew anything about diabetes. So we did not look prepared for that scenario. Parents had to be called in. We couldn't get a substitute nurse quickly when that happened. And the truth was, we weren't prepared. We had no plan because we didn't have anyone else besides school nurses trained on really anything to do with diabetes. We do have the great fortune of having a full-time nurse in every school building in my district, but we can't always guarantee that there will be a substitute nurse.
Right.
And we can't always guarantee that the nurse in the building won't be involved in another situation at the exact same moment a student with diabetes needs help. So I looked at all of that, and I saw the growing trend through the American Diabetes Association was to have additional staff in our school buildings trained. So at least 2 to 3 other people besides the nurse would have an understanding and some training on basic care, and how to respond in an emergency. So I put together a toolkit for training our staff, and that involved some lectures, discussion, and then hands-on pieces of equipment that our non-medical staff, our teachers, could manipulate and handle, and practice checking their own blood sugar, and really kind of work with some of the equipment. And back then, it was my hope that I would be able to train enough staff to at least get through that semester, because I was working on this towards my degree. But what I found was that need for training has never stopped. So Here we are, oh gosh, 10, 12 years later, and the training for our staff has been an ongoing, continual, there's been a need for it. There's been a demand for it. And as the trends have changed, so has the training along the way, because we started back practicing with syringes into oranges just as practice tools.
Right.
We've come so far with equipment ever since then. So just trying to keep up with that piece of it has been challenging.
Well, I know tonight we're going to unpack some of that, because you've got some pretty cool things lined up. But first, I know you want to bring someone on as your guest to the show. And so it's maybe if you could give her an introduction.
I have, I'm being joined tonight by one of my colleagues who used to work in my school district, but is currently the Director of Health Services for the state of Virginia, Alexandria Public School District. This is Dr. Robin Wallen. And she has the unique experience of training staff and working with diabetes in 2 different states and 2 different school districts. So she is able to speak to what it's like, as well as I can, setting that type of training up and working in a different state, even trying to do the same things as we are here in Missouri.
Thank you so much, Dr. Park. It's been a pleasure working with you and learning from you. And I really think that for many school nurses, as well as school staff, diabetes can be an overwhelming experience. I remember my first year as a school nurse 25 years ago and having 3 students with diabetes and feeling very lost. So the work that you do in just providing the basic training is, and certainly in order to keep our kids safe, it's very important that others in our building besides the school nurse know how to do that care, as you mentioned before. So I really feel like these training programs are just critical. We certainly have an opportunity also as school nurses to provide care coordination for our families. And oftentimes it's the school nurses that are providing some of the diabetes education for families that they're not getting necessarily, particularly at the beginning of their diagnoses. So I just feel this training is really important, and I'm grateful for you and what you've done and for what we're learning tonight. So thank you.
And then, Robin, with that, could you maybe talk a little bit about the impact it's had, especially in recent times? Because it was just about 2 years ago when I had the privilege and opportunity to interview you when you were still here. So what's been kind of the impact that you've seen from this training?
Well, I feel like diabetes has become a lot more complex as the technology has become more complex. So it just becomes more and more important for staff, nurses, and school staff to understand all the different pieces of technology and the way that those are used in the day-to-day management of diabetes. So I do think that this increasing complexity, as well as certainly having more students, just makes this even more important.
Absolutely. And so with that, I'm going to go ahead and move to the next point. Let's talk about the technology, because we've seen an explosion of it. And Robin, we're going to keep you on for this piece as well, right? So just hang tight. And Katherine, why don't you go ahead and talk to us about diabetes and technology? Because I'm going to tell you right now, I think our audience and our viewers are going to learn some things, especially when they get caught up to speed on what all your research is showing.
Yes, this has been growing so fast. It's honestly hard to keep up with, and I'm in it full time, working in the school setting. We have seen changes in virtually every aspect of care over definitely the past decade, certainly the past 2 decades. But
Right.
I read recently saw a statistic in about a year or so ago that said the use of CGMs, which are continuous glucose monitors, the use in schools has quadrupled in the past year or so.
Wow.
This is something that didn't used to exist about 15 or so years ago. And now we're seeing that as a standard piece of equipment. For people not familiar, a cornerstone of care with someone with diabetes is being able to do a finger stick check, get that tiny little drop of blood, touch it to a little test strip, and then you get a number that comes up, and that's your current blood sugar reading. And then you compare that to whether you're in a normal range or if you're high or low.
Right.
And we would get a picture of that person's blood sugar for just that one moment in time. But now with continuous glucose monitors, the person with diabetes is able to wear something on their arm or their stomach or their back. There we go. There's a picture. And it's a little pod. And what this pod does, it has a tiny, tiny little catheter that remains just under the skin, and it takes continuous readings of that person's blood sugar. So now not only do we have an idea of their blood sugar, we don't just see it in one moment in time, we're seeing it continuously. So readings are transmitted wirelessly to either a monitor or a cell phone that picks up the data, and then that can be tracked day and night. Like I said, we've seen the growth of these in schools pretty much quadruple. Almost everyone nowadays in our school settings that has diabetes is using one of these. And this has enabled us to make a lot better decisions with a person with diabetes. We're not just taking that one moment in time with that one number. We're actually able to see trends, and the data that's submitted from this pod that the person wears comes along with numbers and arrows. So you may see 2 arrows going straight up, and that means the blood sugar is rapidly rising. Or you might see an arrow slanted sideways going down that indicates it's slowly dropping. So a lot more data at our disposal. And that's just one piece of the equipment.
Yeah, let's bring on the next one, because this is pretty fascinating too. So what are we looking at here?
Insulin. So the picture on the left is pretty much the standard way we used to administer insulin. In some cases still do. But we have a vial of insulin here and insulin needles, and it requires the nurse or the person or the parents that's administering the insulin to put the syringe in the vial, turn it upside down, kind of eyeball it, draw out the correct amount, and then administer it to the person that needs the insulin. But what we've seen change is certainly with the insulin pens. That was that middle picture.
Yep.
Easier to use. The insulin is in a cartridge right there in the middle, and all the person needs to do is screw on a little tiny needle tip, and you dial it up on one end, and then you administer it. So much easier to use. But in this case, the pen that we're actually looking at is a smart pen, because it's called the InPen, and it does feed data to an app as well. And I know that picture is really small, but it is telling us all kinds of information as far as the each dose that was given. That keeps track of how much insulin was dialed up and administered. People using this type of technology can get advice from the app. It's using sometimes predictive information to advise the person, if they're going to be doing extra exercise, they may need to adjust their insulin or eating. Everything about diabetes has to do with your activity and your eating patterns. So all of that plays in together, ties together with each other.
And then Robin, in your experience, then how does that app, get you the information you need? Obviously, for the person who needs it, they're getting that feedback, but is there feedback that you're also getting as someone who's overseeing and managing the diabetes within the school?
Well, certainly the nurses that are managing the diabetes are having access to that technology and CGM technology and other technology such as pumps that we haven't even talked about that yet. So, so yes, I do think that it is one of those puzzle pieces that nurses are using to do the care. I think one of the things that we found is that as all of this technology is exploding, it's also really important for schools to have protocols and policies around the use of the technology in school, because there can be a lot of expectations on schools to manage this technology, and it's very important for schools to think through how they will manage that ahead of time. So that's definitely something that we've done in my former district and where I am currently.
Yeah, and Katherine, anything else you'd like to add to that angle?
No, that's a great point, though. We have found the need to, along with keeping up with the equipment and keeping up with the training of people on the equipment, including the nurses, we've also needed to sometimes modify our policies around the use of the equipment in the school setting. So it's utilized in a safe manner, and it also is not disruptive for the student in their school day. We want the technology, we embrace it, but we also need to fit it into a busy classroom and a typical school day. So trying to pull all those pieces together in a thoughtful way has been challenging.
Absolutely. So talk to us about this next slide, because I found this fascinating as well.
So insulin pumps, they have been around for a while, but they've changed a lot. So this picture on the left is kind of a traditional looking pump. Now, insulin pumps have been out there as long as I've been in school nursing. Used to be not many students had them, though. Usually they were older students. Now we're seeing students in preschool and kindergarten with insulin pumps. Obviously, as you can tell, it requires that the student with diabetes has to wear that device. Now, when pumps first came out, they were about as big as that picture you see on the left. They were as big as maybe a pager.
Wow.
Or yeah, they were pretty big and kind of bulky and heavy, and you had to be attached to it with that little catheter that goes into the pod, which is attached with adhesive to the skin. And when it's time to receive insulin, that can be dialed in through the pump, and then it's administered through that little catheter. But the picture you see now on the right, same technology in a sense. That right there is a self-contained pump that is receiving wireless commands from a separate receiver, like a monitor or a cell phone smart device. And you input all the information on the smart device, and then it transmits electronic or wirelessly to this tiny little pod that the person is wearing, and then they will receive the insulin through that pod. Now, these pods, I think, hold up to just a few days worth of insulin, but you can see a big advantage is they're a lot smaller, generally waterproof, and you don't have that little catheter like attached that you have to worry about getting caught in clothing and things like that.
Absolutely. Robin, anything else you want to add to that? Because again, what an advance in technology.
Mm-hmm.
It's amazing.
Yeah, absolutely. And so, Catherine, I got one more slide for you to kind of speak to again, and as you continue on educating us on the technology with diabetes management, it's fascinating.
Yes, this is huge. So for decades and decades, the standard way to treat a person with a severe low blood sugar drop would be with glucagon. And that's the picture that you see there on the left in the red case. That's been around for a long time. If you're not familiar with it, you can kind of think of it as the EpiPen for diabetes. A lot of people are familiar with EpiPens for emergency food allergy reactions.
Yeah.
This is an emergency type medication for diabetes, although not as easy, shall I say, as the EpiPen, because in the case of glucagon, if you're able to see that picture, when you open the case, there's a little vial, and then there's a separate syringe.
Yep.
And with a liquid in the syringe. So in order to administer this, you can try and picture if you're trying to do this in an emergency, you have to take the two pieces out, inject the liquid into the vial, which has a powder-like substance, swirl that around, turn it upside down, draw it back out into the vial, and then prepare to give that as an injection. But the new advance on that picture that was on the slide, if you go back to that slide for just a second, the newest advance is that now we have something called Baqsimi. And Baqsimi does everything I just described. It can be used in an emergency for someone with a low blood sugar. And it's a nasal spray. So we're seeing more and more of these medications for emergency type situations coming out as nasal sprays, it seems. We also have a new one out for seizure disorders that's also now in a nasal spray form. So I think that the trend has turned towards trying to make some of these medications easier for lay people in particular to be able to be trained on and to give in an emergency if they have to.
Well, I'm going to be honest with you. I just think it's kind of a no-brainer if you just have to understand that that's a spray, undo the top and take your dose, right? So, Catherine, here's my question. So this is a trend, and I'm someone who has, a daughter in high school, Now, granted, she doesn't have diabetes, but a couple of her friends do. So how do we get more information to people about these newer medications, if you would, or solutions, if you would, because it seems like, schools could be kind of all over the board on this.
Mm-hmm. And that is true. Education is such a huge piece of diabetes, and that's a part of nursing that I've always been interested in, is the education piece,
Yep.
which is, I guess, why I created that toolkit years ago, and we're still using it. I do think that's really an important part of really teaching about any chronic health condition. School nurses have a really unique role in that we can advocate for students with chronic health conditions. We have
Yep.
such a wide audience in our schools, being the only health professional in a building typically. So the audience is there. We also have access to and a frequent contact with the parents, students, school staff. So when we're thinking about spreading the word and teaching about some of these new medications and new trends, we as the nurses have this huge audience out there. So I think I would challenge maybe my fellow colleagues in school health and school nursing across the state to really look at and examine what more that they could maybe do to bring some of this information out more to not only their school community, but the community as large. I think
Yeah.
the audience is there, and it just takes someone to kind of bring it out there.
Absolutely. And I got one last slide for you, if you could speak to on the technology. And
Uh,
what are we looking at here?
Closed loop technology, that is a term that is used for something that's often also called an artificial pancreas.
Wow.
People with diabetes have issues with or problems with their pancreas making insulin. So what this closed loop technology is trying to do is simulate how the pancreas works and what happens in a person without diabetes, how all those pieces come together without you even realizing it. So here we can see the person with diabetes is wearing a transmitter, continuous glucose monitor, and that transmitter is sending information to the pump. You can see on the other side where the pump is attached. So these two pieces are actually communicating with each other and talking to each other and figuring out between each other based on the blood sugar numbers and the readings and based on the insulin that the person has been receiving kind of in the background in low doses. These two pieces can figure out essentially how to monitor that person's blood sugar. In a person without diabetes, that's happening all the time. You're not even aware of that. When you eat food, your blood sugar rises and then insulin is released, and that helps bring your blood sugar back down. So in this case, that's what these pieces of equipment are doing. They're essentially trying to come as close as possible to mimicking what actually happens in a person's body in regards to insulin and glucose.
Wow. Fascinating. Robin, anything else you'd like to add to that, to this, obviously, this closed loop system?
Well, one of the things that we had encountered at least a few years ago were some homemade devices, because these are very, very expensive. And that does present unique challenges for schools, because we generally want to know that a tool is FDA approved prior to actually using it in a school setting. So there can be some unique challenges with the homemade closed loop. And I don't know, Catherine, if you wanted to add anything to that. But I know we've seen that.
Yeah, that is true. There's only a few FDA approved manufacturers right now out there that the FDA has officially put their stamp on that are approved, meaning that there are a lot of do-it-yourself or DIY, sometimes it's called, pieces that people have put together. It's certainly understandable because a lot of the equipment is so expensive. And like I said, I think there's only 3 systems right now that are FDA approved for what we just talked about. There are a lot of pieces, though, that can be purchased and kind of pieced together, but the efficacy, how well they work together hasn't been really researched as well. So we tend to really focus on the FDA approved right now because through the school setting anyway, we are obliged to follow FDA approved medications and
Right.
use of those through our medication policies.
That's good. So, Robin, we want to thank you for joining the podcast, and just sit in the green room because we may be able to bring you back. You never know. But yeah, we're gonna kind of shift gears here from the technology, and there's a couple of big announcements, and I want Katherine to kind of get a chance to unpack that. So, thank you, Robin, for being here tonight on the podcast. Okay, so Katherine, big breaking news. Talk to us about what is going on with publications and partnerships.
Yes, well, first of all, with partnership with Dr. Ahn, who is an associate professor at Washington University here in St. Louis. About 2 years ago, it was in July of 2020, I was approached by him and our state school nurse consultant, Marge Cole.
Yep.
And Dr. Ahn had some questions about diabetes in Missouri schools and what was it all about? How was it happening? Were school nurses following the national guidelines that were out? And so he wanted to start this research project to look at what Missouri schools were doing with diabetes management. So this was definitely something I was very excited to be part of, very interested in. And so that was in 2020. That first year, he was able to send out surveys to many school nurses in Missouri. Marge Cole and myself were reviewers of his initial work and just kind of looking at the research and guiding him when he had questions. The surveys were filled out and returned, and based on that initial research project that first year, 4 publications have since come out of that. The most recent one being from, I believe it's 20, I think you have a link for it that you can share.
All right,
with
let
your
me
viewers.
bring that up. Yeah,
I think
hang
you
on.
do. Yeah, this was talking about the study aims.
Yeah.
But the most recent journal article, oh, right, okay.
Do you want
There we go.
do you want
Yeah.
this or this?
Yeah. Either one. We'll see
Yep.
the initial findings here. Yeah, definitely were actually no surprise to me at all. They talked about key barriers being sometimes, lack of knowledge, lack of training. So none of this, as a school nurse myself, was a surprise at all to me. But really exciting because Missouri has never done work on diabetes at this level. At such a caliber of expertise and research. So it was very exciting to just really bring this out into the open. So these were some of the findings that came out of here and then spurned on a couple more articles. The most current one was published in 2022. So obviously just kind of, I think it was June of this year. And that one is the determinants of school diabetes care services and quality through the lens of a school nurse. And this particular research article did in-depth interviews with, it turned out they started with, I think, 30 school nurses, but in the end, it ended up with, I believe, 11 nurses where they did full in-depth interviews and really got some good quality data through this process. And this really added more of a descriptive piece to all the numbers and the data that had come out of this study so far. The goal with Dr. Ahn and his research is that he next wants to bring it onto a more national stage. So trying to replicate the findings, the research, the surveys that were used in Missouri to a bigger audience and just continue on with the data that he's already kind of discovered for us here in Missouri.
That's really exciting news. So how does that tie into this next point?
Yes, we are very excited about this. This is brand new. In fact, our partnership with St. Louis Children's and / WashU Department of Pediatrics, this new partnership will be taking place next week, next Tuesday, because in my district we have a professional development, which means there's no school for students that day, but the staff will be working as in meetings and doing different work on their own. The nurses will be gathering together as a group in our district and meeting these new partners and receiving some in-depth education and training from this team. And they're coming out of Washington University as part of the process that has unfolded since Dr. Ahn started this research project 2 years ago. St. Louis Children's and the Department of Pediatrics has always had this training for lay people and for parents in the community, but they realized this past year that maybe they should open that up to school nurses and schools. Wow. So we are welcoming them into our district. We're one of the first districts that will be receiving some additional training from them. And the really exciting part about this partnership is that for any students being seen through Washington University pediatric endocrinology, they will be able to track and see if providing additional training and support to school nurses has a good outcome for their patients as they see them in the clinic. Their students with diabetes. So they want to see how much of a difference that can make by adding training into the school and supporting the nurses, how that affects the outcomes for those students.
You know, we're going to have you come back on the podcast, right? So you can share these results.
Yes.
No, seriously, Katherine, this is such exciting news.
It is.
And to see what we're doing in Missouri and what you and some others are doing on the front lines, it's so exciting. And
yes,
thank you so much for sharing this. And now, as we kind of get into the last segment of our podcast, a lot of times, a lot of our viewers are wondering, hey, what can I do? Or maybe you're a professional watching, what can I do? Well, let's go to our calls to action. I'll start with this first one, and maybe you can unpack this for our audience. When you say sharing information, what specifically do you mean?
I think it's really important especially for parents to know that when there is a student with diabetes that starts at school, or a student that has a new diagnosis that begins back at school with this new diagnosis, that student is definitely on the radar of the school and the nurse. Yeah. Even before the nurse and the parent has a conversation, we have that on our radar, and we are already making plans behind the scenes. Sometimes that isn't always obvious or goes unnoticed, but as soon as a nurse is aware, as soon as the school is aware that a student with diabetes is returning or has a new diagnosis, we are making a lot of plans and talking to staff, setting up training, looking at the school day, looking at school schedules, trying to piece that all together. So just know that parents should know that we have instantly made that a priority in our building. Also, a DMMP, which is the acronym stands for Diabetes Medical Management Plan. That's really, really become critical in this day and age. It's about an 8-page form because it's really grown over time. But it's not only doctor orders, it's really expanded doctor orders. Yep. And it's something that in order for the school and for the nurse to give the best possible care to that child with diabetes and have the best plan in place, that DMMP is really vital. So taking the time to piece that together and work with the nurse and the doctor to get that in place is really important.
Absolutely. So then the other part of this is, and you've already mentioned it, but what do you mean by what parents can do? As you say, what can they do, and or what do they need to know?
Well, I guess definitely, like I just indicated, knowing that the school nurse has already made your child a priority. Our students with diabetes really are the ones we worry about most in the school setting, I think. Um, and we worry about many students, but the student with diabetes is one that is always at the very top of our radar. Because as the day goes on and the student goes through their school schedule, there's so many issues and things that could happen that we're always trying to either prevent or facilitate. So definitely, parents should know that we do a lot of things behind the scenes that, again, maybe aren't obvious, but talk to the school, talk to the nurse, start that conversation if you haven't already, because
Right.
I think a lot of parents might be surprised to see all the work that does go on behind the scenes, as far as rescheduling lunches and snack times and worrying about field trips and things like that.
Yeah. So with that, I thought would be a great idea, and so did you, that we should maybe bring a parent on of someone who's actually on the front lines dealing with this. You want to set up our next guest?
Absolutely. I am so excited to be joined here by one of my colleagues. Nicole McLemore is a substitute school nurse in our school district. She is also the parent of 2 students with type 1 diabetes. So she has a really unique perspective in that not only is she a parent, she also works in the school setting with
Right.
other students with diabetes. So she can kind of see different perspectives there.
So Nicole, you've been, listening to us this whole time. Can you maybe give us, a little insight from the parent side of things and how you're able to kind of keep up with things, and especially with your 2 children having to oversee their diabetes management program?
Yes,
I have
and
diabetes too.
yes, so this is actually one of my diabetics, and the reason I have her near me is so I could show you her device. So what she sees on her end versus what I see on my
Yeah,
end.
I'm gonna make her screen bigger. There we go.
Yeah. So this is Reagan, and we are dealing with a low right now. But that is what so she has an insulin pump. She was diagnosed when she was 2.5 years old, and we started her on a pump at 3. And, I will say, from the parent perspective, when your child starts kindergarten and they've been diagnosed as a toddler, it is scary. They have come from being with you sometimes 24/7. We just did morning preschool. So it's take off, those 3 hours to then.
And also because of the gluten.
Okay. To then being in the school for 7 hours a day, you're worried, and you want to, you don't want to be a helicopter parent, but at the same time, you're going to be a helicopter parent.
Helicopter?
Yes. Okay. So, but then also, since I've been a substitute nurse, I know the parent fears. And if they tell me they have a diabetic at the school, sometimes I'll reach out to the parents the day before to tell them, hey, I understand, you are worried. A lot of the nurses will tell the parents that there's going to be a sub. So we can kind of be a little bit more on high alert.
One of the subs did not know about diabetes.
We're not going to talk about that.
Okay.
So, so we just, I'll reach out to them and tell them I am a mom of 2 diabetics. So, it makes them feel very much at ease. With my daughter, so this is her phone. She got to choose the cover, and we did a very easy code so that it's easy for everyone to access it. And this is, I don't know if you can, probably not very well, but this is the screen that she has, and it tells her blood sugar. We actually can dose her from this phone. I had her near me because it only has a certain range that it can be done. It also shows her graph, so we can see what her blood sugars have been for X amount of hours. All right, you can go. Okay. So, but then from my end,
My
I
drawing.
okay,
It's Betty Boo.
thank you. Okay. So then from my end, though, I set my alarms differently because I want to know, and we provided a phone for the nurse's office, and I have those alarms set different for my daughters because I don't necessarily want it going off all the time in class. So I want that low before it's a low.
Right.
So I follow them. We do not have data plans for any of our children, but I have both of my kids. That's the low we're treating right now. It's actually higher than that. Oh no, it's much higher than that. The Dexcom has about a 15 to 20 minute delay. So it's already been treated. It's just coming back up. But like I have mine set to go off at like 85, where hers is not going to go off until maybe 75. And the reason being is that the nurse can kind of get, behind that before we get into a dire situation. So that even though, like you saw the 63 on there, she's not 63 right now, and she's not acting like she's 63.
Right.
So I have that so that it kind of makes, because it is, if you have, and you're in the classroom and you have a child, thank you, if you have a child, an alarm going off that's beeping every 5 minutes, it can get a little disturbing to the class. I have tried to make it so from being on the nurse side, when you're treating a low, sometimes you don't know how much does this child actually need? Because every child's needs are different, and whether they have a closed loop system or whether they're on shots or just a regular pump without a closed loop, they all need different amounts of treatments for those lows. So I make packaged low treats that are kept in the classroom, in the nurse's office. I mean, I know I go overboard, but it's only because being from the nurse side, I see what would help me if the parents would do. So I have those low snacks so that anytime they're starting to get that, the nurse can call into the room and say, hey, give them something from that low snack. And they know the exact amount of carb count is in there. They know what's in there. When they're getting low on them, I give them more. I prepare binders on what to treat, at what point, and kind of about my kids and what they show when they're high and low, any emotions they do. No, you cannot eat that. So, because that's not gluten free. Go talk to daddy. So it's completely different when I'm on the nurse side versus the parent side, but then trying to separate the two, but also combine the two. As far as a parent, what would I want for my child? But at the same time, the nurse in me, what is that going to say? Or how can I help that parent maybe communicate with the school nurse more effectively? Because I think that's the most difficult thing being a parent, is that you have to have that open set of communication with the school nurse. If that's not there, it's going to make the years, especially if they're in elementary school, very, very difficult. And we get that fear that if my child's not in range all the time, are they going to call DFS on us? That's always in the back of your mind. But then, and because it is, and the problem is you have these kids that are in PE, they have recess, there's so many different things that these children have that it's hard, a normal pancreas, it's not an issue. And you can do whatever you want to do, but there's a lot of planning and thinking, going ahead, and technology is great, but that's all it is. It's a piece of machine. It doesn't read like a pancreas reads. So as great as the closed loop systems are, honestly, it gives us sleep at night. It doesn't, depending which system you have, they all have different algorithms. And so my daughter's, it reads 90 minutes into the future. But what it's not taking into consideration is, they might be great 90 minutes in the future, but guess what? 5 minutes, they're going to recess.
Right.
So that 90 minutes is now completely not there. So it's just, it's difficult on both ends, but I will say our school system they're amazing. And I have 2 kids, so I am talking to the nurse just about daily. And so I just think, from a parent standpoint, the communication and, and knowing, and make also things clear at the beginning of the year with your expectations. And then as a nurse, what your expectations are for the parents.
Right. And Nicole, with that, because you're on a national broadcast right now, if you could maybe help, some that might be watching who are parents right now, or who might be watching the replay, what questions should they be asking? Like, what are some of the common questions that you can help them ask the right questions? I know a lot of times, we say, well, communicate, talk to them. Well, I'll just be honest with you. In some cases, what do you even ask? Right. So maybe you could, and Catherine, I'll also throw it back to you as well, because obviously with your background, but we'll start with you, Nicole. What kind of questions should parents be asking the school nurse?
So I always ask, what is it you need from me as a parent? I can tell you from a parent that diabetes is not a race, it's a marathon. And I was very clear at the beginning when I said, I do not want my children to manage more than they can take on. Okay. One was diagnosed at 13 months. I don't, if they need a break and they need me to dose them, obviously I'm going to do that for them. I said, I do not want any pressure put on them to try to, dose sooner than they're ready to give themselves insulin. Let the children take lead. I have asked, what are your places? We, have lockdowns now. So what is something that can help in that? What we did is my children carry around a backpack all day with them so that if there was an unfortunate case where there is a lockdown, they have all their supplies on them at all times. Okay. We have low snacks in every single room. I will say there's a lot of Facebook groups if you're on social media, and there's, they pinpoint elementary diabetes. And a lot of parents will go on and show what they've done for their children at the school year. From the nurse's standpoint, make sure you're reaching out to those parents ahead of time to fill out all of the prescription forms. Right. Because there's a lot of them. The diabetes medical management plan, reach out to them to get that filled out ahead of time. Because like Catherine said, it's 8 pages and it takes a little bit of time, especially when you're filling it out for 2. Right. I'm very, and like I said, we've been at this for a little while. So, but making, from a parent, making a binder so that you give to the teacher, that you give to the nurse, so that they know your child and before, school starts. Because a lot of things too you won't realize unfortunately until you get into a situation with them. Right. And that's unfortunately the way it goes, that you're like, oh, we really should have said this, or we really should have said that. Know that at different grade points when you are make sure you ask for a 504 right away, because that protects your child's rights in school. And they might change depending how old they are. My kindergartner right now does not need extra time for tests because she doesn't have tests. But my 2nd grader, when she gets to 3rd grade next year and she takes the MAP testing, which is the Missouri test that they give them, if her blood sugar is not in range, she's not going to perform well on it. Right. So making those adjustments and keeping up with it. So always making sure that as a parent, your child is protected by whatever laws they have in place for your state. But then as a nurse, making sure you're protected on the nurse's side, and making sure the parents know that if they have a Dexcom, that you need to have a way to follow them. And if you need to provide that, then the parents need to know. I would give them ample time because it's a cell phone and not everyone has them laying around. So, just different ways to follow them, or if they're using a computer program to do that. Also, knowing what's allowed in your school district. Our school district does not allow DIY pumps unless the children or teenagers, however old they are able to do it themselves. And a lot of people like the DIYs because you have better control with them. I'm being honest about that. You do. But my kids are little and they cannot use them themselves. So that's something that I did not know until we had which Katherine arranged it was for parents of children in the district that have diabetes, and what the district rules are and everything like that. So as a parent, that was extremely helpful to me because I knew exactly what the district's expectations were as far as any of their devices go.
Nicole, thank you so much. Katherine, and anything else you'd like to add? But that was just so awesome. I mean, this is why we're doing podcasts. These are the kind of conversations that we need to have. Nicole, thank you so much for sharing that on both levels. Yeah, with you being a nurse as well as, you're living it as a parent. Those insights. Katherine, anything you want to bring the bookend on that as what are some helpful things for parents to ask?
I think Nicole summed it up really, really well. And I will add also, that is probably one of the reasons I've had an interest in working with students with diabetes all these years, because every single student and situation is different. And you can't assume once you have a plan in place for one student that will work for future students with diabetes, because she is right. Everyone and every situation is really different. And sometimes that's hard for school staff to understand, especially if they've ever had a student before with diabetes. They'll assume it'll be the same with every student they get in the future. And that's not the case. So taking the time out to really get to know each individual student and keeping them not only safe at school, but allowing them to be with their peers and take part in school as much as possible, so that diabetes doesn't become, overwhelming in their school day. Those are just really important things. So I guess, again, that communication piece and making that effort to get to know the student and the family and work with them at the level that they're at is really important.
Absolutely. So as we begin to wrap up, we talked about, actually, Karen, you're the one who brought it up, but Katherine, great point here on, where you can go get resources. One of those places, and you can go right here to Missouri. It's actually mohealthyschools.com. That is our website. We actually have links to the articles that actually Katherine presented tonight that you can go check out, as well as some other things related to diabetes management. Katherine has been working with us, and Marge Cole has been working with us for quite some time. And we've got a really nice library of resources available. So again, that's just a really, easy place for you to go. And then just want to let everyone know that coming up and on November 22nd, our next episode on the MHS cast is going to be, we're bringing Lisa Farmer on. Some of you might remember her from just a few years ago. She's our school nutritionist for the state. And she would put out a show called Tasty Tuesday back when we were actually stuck at home and had stuck in home snacks. And she had a lot of wonderful information. Well, we're bringing her back in just a few weeks. And she's going to talk to us about nutrition and holiday food. And I know it's going to be a very fun episode. All I can tell you is I've been on a few shows with her in the past, and she's just going to have some great advice when it comes to nutrition. So as we wrap up, I'm going to bring Robin in. And so I kind of want to wrap up the show this way. I'm going to give each of you 30 seconds as kind of your soundbite on diabetes management. What would be the top takeaway that maybe viewers should take away from tonight? And Nicole, we'll start with you. I'm not sure she heard me because she's muted. Can you talk or no? Okay. All right, Robin, I'll go to you then. in 30 seconds, what would be, a top takeaway for, for our audience?
I think that schools and school nurses really, really care about the health and safety of students with diabetes, and we really want to partner with you in this journey.
Yeah.
The work that Dr. Park has done in supporting students with diabetes is just a great example of that.
Absolutely. And Dr. Park, here we go. It's been a great episode. Thank you again. It's been so awesome. Again,
Thank
what's
you.
the final word from you?
Well, Robin said it really best, but again, just to reiterate that point, schools are ready and willing to take this on. School nurses, give them a chance, get to know your school nurse, and we are continually learning about diabetes as we go along, as professionals as well. So trying to stay one step ahead and current with all the changes out there. So absolutely, we want to do the very best to take care of students in our schools. So definitely reach out to us.
Well, on behalf of Missouri Healthy Schools, we want to thank each and every one of you for what you do on the front lines to make our schools better, safer, and certainly the love and care that you have for all those students that you are all working with. It's a great calling and it's a great responsibility. And we know in Missouri that they're in great hands with all three of you. Thank you again for taking the time tonight so we could have this big open discussion on diabetes management. And definitely, Katherine, we will have you back because we definitely want to hear about how that new partnership goes. It sounds so exciting. And we definitely want to give you the chance to share the results of this upcoming study. So just thank you again. And tonight was just a great time. And again, we just want to thank you all for tuning in. And if you get a chance and you are watching this replay, you know what? Why don't you share it with someone that you know that may benefit from hearing what we talked about tonight? Well, for my guests, I want to say thank you again. My name is Guy Danhoff. We want to thank you for watching right here on Missouri Healthy Schools, the MHS Cast. Thank you and have a great night.
Thank you.